Congratulations on the birth of your baby. It's nearly time to go home, and so we've made a short video to help you as you prepare to leave. You can watch this video again at any time by visiting our website or Facebook page. Hello, my name is Wendy and I'm here to help you as you prepare to go home. I'm sure that you're very excited about this and are eager to go, but please bear in mind there are things your midwife must do to ensure the process runs smoothly. We can be a very busy ward, and this may take time as we are also caring for other women. It is important that you are physically well enough to go home. It is not always necessary to see a doctor, but if it is, this usually takes place on the morning ward round. The midwives like to know that you're able to feed your baby. If you're breastfeeding, it is important for us to be able to guide you with your positioning and attachment so that you get off to a great start and reduce the likelihood of problems such as sore nipples. For those wishing to formula feed, it is important that we guide you to be able to make up your feed safely and offer advice on the best way to offer a feed. Ideally, you should receive a newborn examination for your baby before going home. If you're taking an early discharge, we can arrange this to be done within 72 hours of birth by coming back to the hospital. Occasionally, it may be done in the community. Newborns also require a hearing screening test. This usually takes place on the ward by our hearing screeners in the lilac uniform. If it is not done prior to going home, then you'll be invited to attend a clinic. Also, please remember to tell us if you're going to stay at a temporary address or have changed your address during pregnancy. We will let everyone who needs to know that you've had your baby and that you're going home. This includes the GP and health visitor. Your care will once again be given by your local community midwives. You'll receive a telephone call or a visit depending on your geographical area you live in and your care needs following birth. If you've not had any contact from a midwife by 4 p.m. on the day after your discharge, please contact us on panel ward. Your community midwife will continue to coordinate your postnatal care, usually up to 10 days, but will be still available for advice up to 28 days following your birth. Your health visitor should contact you in the days following your discharge from hospital. Registering the birth. You have 42 days or 6 weeks to register your baby's birth. This can be done at Harrogate or any of the UK registrar's offices. Depending upon your marital status, either parent may register the birth or only the mother. Appointments to register must be booked in advance. Failure to register the birth may result in a heavy fine. Please also ensure that you register your baby at your GP surgery as soon as possible. Please use the QR code to register. Your postnatal health is important, and it is vital to have a strong network of support around you, whether that be family or friends. Please remember that having a newborn baby can be an emotional and tiring time. It is normal to get baby blues due to hormonal changes and tiredness, but if you feel that you are feeling depressed and low, it is important to reach out and speak to someone. Please remember to arrange a postnatal checkup with your GP. This is usually done 6 to 8 weeks after having your baby. The GP will usually complete the 6-week baby check at the same appointment. If you have not had a smear test within the last 3 years and you are over the age of 25, please arrange this at your GP surgery. It is also time to consider your contraception choices. Although sex may be the last thing on your mind, it is important to think of contraception, as you can get pregnant as early as 3 weeks after the birth of your baby, even if you are breastfeeding. Please discuss your choices with a healthcare professional, as the contraception that you may have been on previously may not be suitable now, especially if you're breastfeeding. The majority of women recover from childbirth without any problems. However, it is important to recognise and get the appropriate treatment for important issues that could potentially arise. please contact your midwife or 111 if you have any of the following issues. But if you think that you require more urgent assistance, please dial 999. If you wish for clarification on what is deemed an emergency, speak to your midwife discharging you prior to going home. It is normal to bleed vaginally for up to 6 weeks after having your baby, even if you've had a cesarean section. Heavy vaginal bleeding is not normal. If you are having to change your maternity pad every 30 minutes or your blood loss has become heavier. Clots are also normal, but not if they are larger than a 50p piece. If you're feeling unwell, such as a high temperature, fever or chills, a fast heart rate over 100 beats per minute, chest pain or breathlessness, if you have calf pain in either of your legs, you have a severe headache that will not go away with paracetamol, you have smelly vaginal discharge or a wound that is not healing, red painful areas on the breast, this can be a sign of mastitis, mainly seen in breastfeeding mothers. Following on from when should I be worried, more specifically if you have a cesarean section, it is important to know the signs of a wound infection. An increase in wound pain, swelling or redness, an increase in the amount of fluid coming from the wound or a change in colour, a bad odour coming from the wound, having a temperature over 37.5 Celsius, sweating or chills, feeling generally unwell, having a fast pulse, the wound feeling hardened or hot. If you have any sign of infection, it is important that you get treated.
Wound care following cesarean section. Your dressing will be removed usually 24 hours after cesarean section. When possible, wear loose-fitting clothing and underwear. This will help prevent irritation to the site. Be vigilant with hand washing, especially before and after visiting the toilet and changing sanitary pads. Clean the wound daily. A shower is usually sufficient, and gently pat dry with a clean towel. Avoid touching the wound unless absolutely necessary. The stitches will usually dissolve on their own without the need for removal. However, occasionally a non-dissolvable material may be used. You will be advised of this before you leave the unit, and arrangements will be made for them to be removed. It is normal to experience some wound pain, and for there to be a small amount of swelling and redness. There may even be a little clear fluid escaping from the wound edge. Remember to take regular pain relief. Please ask your midwife for the recommended times and dosages of pain relief if you are unsure. Always follow the packet instructions. Pelvic floor exercises. Your pelvic floor is responsible for you being able to maintain control of your bladder and bowel function. Irrespective of your mode of delivery, it is important to do your pelvic floor exercises every day. We have several leaflets available for you to take home and will also be added to your Badgered Notes account. Information can also be accessed online at harrogatehealthhub.co.uk. Should you experience any difficulties, please do not suffer in silence. You can contact our women's health physios here on telephone 01423 553089.
If you've had a vaginal delivery with or without assistance, you may have had a tear or a cut. Even if you've not had any stitches, you still may have some discomfort. Painkillers such as paracetamol and ibuprofen can be taken providing you are not allergic or have asthma in the case of ibuprofen. Please follow the dosages on the package. Cold packs can be soothing, but do not place them directly onto the skin and use in 20 to 30 minute sessions. It is very important to wash your hands before and after going to the toilet or changing your pads to prevent infection. Use plain warm water to clean your perineum and pat dry gently with a clean towel. Wear comfortable, breathable fabrics and change your sanitary pad frequently. We cannot recommend the use of complementary therapies such as arnica or witch hazel. If you wish to use these products, please consult a qualified therapist. Please remember pelvic floor exercises.
When should I be worried about my baby? You need to call 999 if your baby is pale, floppy or unresponsive, has a fit or convulsion, vomits green fluid, a rash that does not fade when pressed, stops breathing or goes blue, or cannot be woken. You can also call 111 if your baby has a high-pitched or weak cry, pale all over, grunts with each breath, breathing faster than normal, not interested in feeding, passing less urine, has a bulging fontanelle, this is the soft spot on the top of the baby's head, is dehydrated, has a high temperature or sweating, or there is blood in the stool. Car seats. Please follow the car seat manufacturer's guidance on safe installation and how to use your car seat. Safety experts and most car seat manufacturers recommend that babies should not be in a car seat for longer than 2 hours at a time. Once you reach your destination, please take your baby out of their car seat. It is a travelling device and not designed for long periods of sleeping. Please note, we are not trained or able to put your baby in a car seat prior to discharge. Breastfeeding is helping to protect your baby from infections, allergies, diabetes, leukemia, and many other diseases. It is the most precious gift you can give. Your baby needs no other food or drink. If you have concerns around feeding when you get home, please ask for help from your midwife. Before going home, make sure you are happy positioning and attaching your baby. A member of staff will sit with you while you feed and go over the signs to look for to know that your baby is feeding well. Hand expressing can be a vital skill in the early stages of breastfeeding. Ask if you have not been shown this. Always follow your baby's feeding cues. You can't overfeed a breastfed baby. Sometimes your baby just wants to feed for comfort. You can also feed your baby when you want to, for any reason. How do I know if my baby is getting enough milk? In the first 24 hours of life, your baby will be recovering after birth the same as you. It is normal for them to only have 3 or 4 feeds. We expect at least 1 stool and 1 or 2 wet nappies. From day 2 onwards, most babies feed frequently, but this is not necessarily regularly. Speak with your midwife if your baby is having less than 8 feeds in 24 hours. Your baby should have at least 2 stools every 24 hours, initially black, then changing to greeny brown, and finally yellow by day 4. Wet nappies increase every day. Expect 5 to 6 heavy wet nappies by day 5. Your baby will be weighed on day 3. It is normal for babies to lose weight. Occasionally babies lose a little more weight than expected. If this is the case, your midwife will make a feeding plan with you. Support. You can call the National Breastfeeding Helpline on 0300 100 0212. Ask your community midwife or health visitor for support groups in your area, or you can contact our infant feeding midwife, Jo Orgles, on 01423 555 629. Safe asleep for babies. Always place your baby on their back to sleep. Since the Back to Sleep campaign in 1991, the rates of sudden infant death dropped by 79%. Give your baby a clear, safe sleep space in the same room as you. A firm flat mattress with no raised or cushioned areas, no pillows, quilts, duvets or bumpers, no pods, nests or sleeping positioners, no soft toys. Make sure your baby's head is kept uncovered. Keep your baby smoke-free. Babies who are exposed to tobacco smoke before and after birth have a much greater chance of SIDS. Breastfeed. SIDS risk is halved in babies breastfed for at least 2 months. Safer bed sharing. Some parents choose to share a bed with their baby. Don't share a bed if you've recently drunk alcohol, if you or your partner smokes, you have taken any drugs that might make you feel sleepy or less aware, your baby was born before 37 weeks of pregnancy or weighs under 2.5 kilograms. Sofas and armchairs are always dangerous places to fall asleep. Move somewhere safe if you might fall asleep. For further information, please visit the Lullaby Trust.
Early development. New babies have a strong need to be close to their parents, as this helps them to feel secure and loved. When babies feel secure, they release a hormone called oxytocin, which acts like a fertilizer for the growing brain. Holding, smiling, and talking to your baby also releases oxytocin in you, which helps you feel calm and happy. When babies' needs for love and comfort are met, they will be calmer and grow up to be more confident. This supports emotional health in later life. Holding your baby when they are crying still helps them feel loved and secure, even if they do not stop crying straight away.
Icon. A baby's cry can be upsetting and frustrating. It is designed to get your attention. Some babies start to cry more frequently from around 2 weeks of age. Every baby is different, but after about 8 weeks, babies start to cry less and less each week. Not every baby is easy to soothe. That doesn't mean you're doing anything wrong. Don't get angry with your baby or yourself. Instead, put your baby in a safe place and walk away. Do something that will take your mind off the crying, or call a relative or friend who may be able to help. After a few minutes, when you are calm, go back and check on your baby. Never ever shake or hurt a baby. Crisis National Helpline is available on 08451 228669. Pregnancy and birth revisited sessions. Do you have some questions about your pregnancy or birth experience? Do you want to talk things through with an experienced midwife? Do you need to talk before planning another pregnancy? Do you feel like you would like signposting to further support? Please book an appointment with the Pregnancy and Birth Revisited service, an opportunity to talk and reflect with a midwife-led service. A safe and confidential space for you. Birth partners are welcome to accompany you. Sessions are held with a midwife on alternative Fridays in antenatal clinic. You can self-refer to the service at any stage, and we will offer an appointment once your baby is 6 weeks old. Please follow the link to book. Harrogate Digital Maternity Service Friends and Family Test. Your views matter. We value feedback about the quality of care you experienced to help us monitor and improve our services. Scan the QR code for more information and to let us know your thoughts. Harrogate Maternity Voice Partnership, MVP, is a friendly group of service users and professionals that work together to gather information from maternity service users in our area to shape and develop local maternity services. We do this because your voice matters. We want to hear about your experiences to celebrate and build on everything positive while acknowledging and working on areas that could be improved. Get in touch via our social media or our website if you'd like to give feedback or join us. Time for home. Please ensure you have access to your badger notes and red book. Contact numbers, drugs to take home if you need them. You are welcome to rewatch this video now, or you can find it on our Trust website. If you have any questions, please ask your midwife prior to your discharge. We appreciate any feedback of our service. Please complete a family and friends questionnaire if you have the time. From everyone at Harrogate Maternity Department, congratulations again and enjoy your new baby. Thank you for watching our discharge video.